Hello, everyone. My name is Roberta Valella, and today I will be discussing an important preventative health topic: osteoporosis screening in the postmenopausal woman younger than 65 years who have one or more risk factors for osteoporosis. This presentation is based on the United States Preventative Services Task Force, or the USPSTF, Grade B recommendation on osteoporosis screening. The USPSTF recommends screening postmenopausal women under the age of 65 who have risk factors and are at increased risk for osteoporotic fractures. Screening is typically performed using a dual energy X-ray absorptiometry, commonly known as a DXA scan or DEXA. Today, I will review osteoporosis statistics, discuss a community education campaign, and explain the health belief model and describe how screening and evaluation would be implemented. Osteoporosis is a disease characterized by decreased bone density and deterioration of bone tissue, which makes bones fragile and more likely to fracture. Often called a silent disease, osteoporosis may not be detected until a fracture occurs. Common fracture sites include the hip, the spine, and the wrist. These fractures can result in chronic pain, disability, reduced independence, and even death among older adults. The USPSTF emphasizes that early identification and treatment can significantly reduce risk fracture and improve quality of life. Osteoporosis is a significant public health concern. According to the Centers for Disease Control and Prevention, approximately 18.8% of women aged 50 and older have osteoporosis compared with only 4.2% of men. Research also shows that approximately 1 in 10 Americans age 50 and older has osteoporosis, and millions more have low bone mass, which is a precursor to osteoporosis. These risk factors include postmenopausal status, low body weight, smoking, excess alcohol consumption, family history of hip fracture, long-term corticosteroid use, and rheumatoid arthritis. Women with these risk factors should undergo further assessment to determine whether osteoporosis screening is indicated. This campaign is titled Strong Bones for Life. The first measurable goal is to increase osteoporosis risk assessment screening among eligible women by 25% within the first year. The second goal is to ensure that at least 80% of women identified as high risk receive referrals for a DEXA screening and follow-up care. The third goal is to improve osteoporosis knowledge by at least 30% after participation in the educational program. These goals are measurable and focus awareness, screening, and appropriate follow-up care. This campaign will target postmenopausal women ages 50 to 65 who have one or more of the osteoporosis risk factors we discussed. The proposed community is Ward County, North Dakota, which includes the city of Minot. Ward County has a population of approximately 68,000 residents, with nearly 49% being female. Based on local age distribution data, approximately 6,500 and 7,000 women fall within the target age range and may benefit from osteoporosis risk assessment and education. The county includes rural and urban populations, making community outreach especially important for improving access to preventative health care services. The educational campaign would take place at community locations such as public libraries, community health fairs, senior centers, civic centers, and local workplaces. I suspect these settings because they are easily accessible, trusted by community members, and capable of reaching women who may not routinely visit healthcare providers. These settings will also allow partnership with local healthcare organizations, pharmacies, and public health departments. The theoretical framework guiding this campaign is the health belief model. The health belief model suggests that people are more likely to participate in preventative health behaviors when they, 1, believe they are at risk, 2, understand the seriousness of the condition, 3, recognize the benefits of action, 4, perceive few barriers to participation. The campaign will increase participants' risk understanding of osteoporosis while addressing barriers such as lack of knowledge, fear of testing, transportation concerns, and misconceptions about bone health. Educational materials, reminders, and referrals will serve as cues to action that encourage women to obtain screening. The screening activity will begin with a brief education presentation covering osteoporosis risk factors, bone health, nutrition, exercise recommendations, smoking cessation, alcohol moderation, and USP/STF screening guidelines. The participants will then complete an osteoporosis risk assessment questionnaire, and the assessment will evaluate their age, menopausal status, family history, smoking history, alcohol use, body mass index, medication use, and previous fractures. Women identified as being at increased risk will receive referrals for DXA's testing and provider follow-ups. The primary diagnostic test is the DXA scan. DXA results are reported as T-scores. A normal T-score is negative 1.0 or higher. A score between 1.0 and negative 2.4 indicates osteopenia, which is low bone mass. Women with abnormal findings will receive referrals to their primary care provider and appropriate specialists for evaluation of treatment. They will also receive education regarding calcium intake, vitamin D, weight-bearing exercises, and lifestyle modifications that support bone health. This campaign will be evaluated using both processes and outcome measures. Process measures include the number of participants attending, number of screenings completed, and the number of referrals made. Outcome measures include increased knowledge scores, increased screening rates, follow-up appointment completion, and patient satisfaction. In conclusion, osteoporosis is a serious but often preventable disease. Early identification through screening can reduce fractures, improve quality of life, and decrease healthcare costs. By implementing a community-based educational campaign focused on high-risk postmenopausal women, healthcare professionals can improve awareness, increase screening participation, and support healthier aging. Thank you for your time, and if you have any questions, you can reach out to me.